But it's Hi, sorry, it's Joan Roberts, and we'd like to welcome you to our 10th School Health Research Network webinar for schools. So those who don't know me, I'm Joan Roberts, manager of the network. This is the third webinar of this academic year, and we will be talking about some research made possible through your survey results from 2015-16. So the other webinars are now available on the website, and you can follow those at your leisure. And very shortly after this has finished, in the next week or so, this webinar will also appear on the website. So it's a bit of a different webinar this time. So I'm just going to so I'll just move that forward, because we're actually going to be splitting the webinar into two, so it's like a double bill. So we'll start with something that all schools really have to consider, and that's that balance between supporting health and well-being and ensuring the academic success of we have two experienced webinar givers to do this, Dr. Hannah Littlecott and Dr. Sara Long. And then after this, so Gillian, who you'll recognise, and I will turn to a topic close to our hearts, which is looking at the student health and wellbeing reports and how they can be used in schools, both interpreting the data and just encouraging you to make the most of them. So I'm going to hand over now on a different camera to Hannah and Sara.
Okay, hi. So I'm going to be starting the presentation now, and I'm Hannah Littlecott from Cardiff University, and I work very closely with the School Health Research Network and the data. So I want to talk to you a little bit about the link between health and educational outcomes. And at the moment, in a lot of areas, it's viewed as maybe a zero-sum game, whereby implementing health may detract from your pupils' educational attainment. And therefore, in lots of instances, there may be resistance from policymakers and school stakeholders to implementing health improvement policies and practices. Although I must say in Wales, it's a very fertile environment for health and wellbeing, which is brilliant. So yeah, this phenomenon is called a zero-sum game. So these two aspects are framed as competing priorities, and they're seen as diverting resource away from the core business. So as you can see from the diagram, there's no overlap between the two priorities. So there's been limited research in this area, but the reviews that have been done that have shown mixed evidence. But actually, the direct effect of health improvement policies and practices on educational attainment is rarely measured. So there's one review of multi-component interventions, which found positive effects on and no impairment of educational outcomes. And there's also been a review of health promoting schools interventions, which found that attendance and attainment data were rarely collected alongside health and wellbeing interventions. So that's maybe something important to consider for academics going forward. So in light of this, we decided to conduct the current research that I'm presenting to you today. So we aim to understand whether differences in health improvement policies and practices were associated with educational attainment. And our hypothesis, based on the previous research, was that attainment may be lower in schools which dedicate more resource to health improvement. So the methods we used were as follows. So health improvement policies and practices we defined as actions undertaken by a school which aimed to improve students' health and well-being. So these included the creation of policies, the delivery of programs and services within the school, and the provision of specialist staff, such as school nurses and teaching assistants. So the data we used was from the School Health Research Network, so the school environment questionnaire, which each school would have received. And this was the questionnaire that took place in 2016. So at this time, network schools represented just over half of all secondary schools in Wales and had representation from all 22 local authority areas. So the questionnaire, for those of you who haven't seen it and aren't familiar with it, is based on the Health Promoting Schools framework. So it comprised of questions related to health and wellbeing education in the curriculum in the school, and the social environment in terms of health policies and student involvement, and the creation of partnerships with schools and wider communities relating to health. So the questions focused on the following health and wellbeing issues. So they included questions on physical activity, diet, tobacco, drugs and alcohol, mental health and wellbeing, sex and relationships, health service providers, behaviour and discipline, and self-harm prevention. So we had...
Yep, sorry. Continue.
And then also we obtained data on free school meal entitlement and attendance and attainment data. And this was found on mylocalschool.wales.gov.uk, which I imagine a lot of you will be familiar with. So once we'd obtained this data, we conducted some statistical analyses, and these were used to test whether health improvement activity was actually linked to educational outcomes. And during this, we adjusted for socioeconomic status in the form of free school meal entitlement, so that we could be sure that the results weren't just as a result of variation according to deprivation. So results showed that, well, first of all, we managed to collect data from 100 out of 115 schools, and that was 87%. And then we managed to collect educational performance data from 97 of these 100 schools that took part. And the correlation showed that most difference in attainment between schools was associated with socioeconomic intake of the schools, the pupils. And it showed that health improvement policies and practices are associated with better educational attainment, particularly for younger students. We'll talk a bit more about potential reasons why later. And so first of all, we looked at key stage 3, so 11 to 14 years, and we found significant links between educational performance and the following outcomes. So overall embeddedness of health in the school, which was measured as a sum of all the health improvement policies and practices relating to curriculum and environment. And then embeddedness of physical health in the curriculum, coverage of written policies, parental involvement, student involvement, and partnerships. That no links were found for mental health, education, and organisational commitment to health. So then moving on to key stage 4, 14 to 16 years, we actually found no significant links between health improvement policies or practices and educational outcomes and attendance. However, all associations were in a positive direction, which kind of means that, you know, it's likely that any of these actions may have led to better attainment or attendance. So in terms of attendance, only parental and student involvement had significant links, but all other associations were also in a positive direction. So in conclusion, there was actually no support for the hypothesis that increased health improvement policies and practices within schools compromises educational performance. So the concerns that have driven the zero-sum game hypothesis and have led to perhaps a narrow focus on educational metrics in schools appear to be unfounded. So our results show that there was some evidence that within the younger age groups, schools with a higher emphasis on pupils' health and well-being, tended to do better educationally. Whereas for Key Stage 4, there were no such links shown. But we've kind of discussed this and may think it may be due to a decrease in the influence of the school on students' lives as they get older. So as parental influence also decreases and the influence of peers increases. So what are the next steps after this? We need to further persuade schools and educational policymakers that health improvement policies and practices will not have a detrimental effect on students' educational attainment. Although a lot is already being done in Wales, we can definitely improve on this. We also need a further focus on student and parental involvement in schools to really try and increase attendance rates among pupils. So the School Health Research Network has now expanded to all schools in Wales. So future studies and analysis will be able to use these larger data sets, and that will enable us to investigate the role of the potential mechanisms of these associations, but also look into the role of health in reducing or increasing socioeconomic inequalities in educational performance. And that's what my colleague, Dr. Sara Long, is going to talk to you about now.
Have I got a microphone over? My microphone's open. That's brilliant. I just wanted to just ask, just sort of comment really to Hannah. The conclusions about the Key Stage 4, do you think, I mean, could that be to do with the fact that schools often have to focus on the sort of exams and a crowded curriculum with the Key Stage 4, and maybe do a bit of less health work? Do you think that could be a factor there?
Although we measured the amount of health improvement activity that was going on, so.
Was that separate from Key Stage 3 and 4 though?
Yeah. Well, no, that's true. Yeah.
Sometimes it is a bit different. I don't know if anybody wants to, add a question about that. So that would be good. But and also just to say about the sort of the guidance slide that you.
Vital to share that widely with the Welsh Government and maybe regional consortium and LEA, because I think that has big implications, doesn't it, for schools? So thank you. So sorry, Sara, for interrupting you, but I think the microphone will head back to you now.
Okay. So I'm going to talk in a little bit more detail, about a recent study that I led that is kind of following on from Hannah's study. And some of what I say is going to be a little bit repetitive because we use the same methods as we used in Hannah's study. For my study, we used the same data sets, looked at the same sort of health improvement variables. So apologies if it is a bit repetitive, but I think it's always good to reinforce concepts anyway. So I'm just going to talk for about 5 minutes about the study that I led on. And just to reiterate about the zero-sum game hypothesis, some people believe that there is no benefit to focusing resources on health improvement in schools because that detracts away from the core business of academic attainment. And the reason, so essentially what we did in the study that I'm going to talk about is repeating the analysis that Hannah did, but among schools with high and low levels of deprivation. And the reason for this is partly because socioeconomic inequalities in health and education, which are apparent during childhood and in the school years, can carry forward and become entrenched and even increase in adulthood. So schools provide a key setting for the delivery of interventions that can potentially reduce inequalities. Okay, so just reiterating some of the methods that we used. I won't go into the same level of detail that Hannah did. The predictors that we looked at were school health policies and practices, and the outcomes again were Key Stage 3 attainment, Key Stage 4 attainment and attendance. And we did some statistical modelling that I won't go into, but it's called regression analysis. And as I mentioned, we looked at the associations between these predictors and outcomes among schools with high and low levels of deprivation. And the way we categorised high and low levels of affluence or deprivation, we used free school meal status. So they were less affluent schools had a higher free school meal status, and more affluent schools had a lower free school meal status. So in the analysis, there were 49 less affluent schools and 48 more affluent schools. Okay, and what we found was that among so these are the results for Key Stage 3 attainment, and what we found was a positive relationship for almost all school health improvement variables and Key Stage 3 attainment among poor schools. We didn't find a relationship between the predictive variables and Key Stage 3 attainment among the more affluent schools. Okay, and similar to Hannah's study, when we looked at Key Stage 4 attainment, there was no relationship among either less or more affluent schools. And a similar pattern was observed for attendance as we observed with less affluent schools. So the predictive variables, so the school health improvement policy and practice variables were predictive of better attendance among less affluent schools, but not among more affluent schools. And essentially what this suggests is that there is no support for the zero-sum game hypothesis, as Hannah's study found, but in fact, among schools with high levels of deprivation, we actually found evidence to the contrary, that the zero-sum game hypothesis is not supported, but actually we found contradictory evidence. Okay, I'm just going to highlight a couple of limitations, the studies that we've just talked about in terms of like research design and methodology, and then I'm going to talk about future research. So I'm always a fan of turning negatives in terms of limitations into positives. So one of the limitations that we've had so far with our School Health Research Network studies, and this is just a minor limitation. It definitely doesn't disregard the evidence or the findings of the studies we've used so far, but essentially, because of the research design, so the research is cross-sectional, essentially what this means is that we can look at associations between variables, but we can't predict cause and effect. So we're looking at associations between variables at a particular point in time. In relation to the particular studies that we've just described, we focused on the quantity of health improvement activity among schools rather than the quality. Okay, so now turning those into positives, with regard to the cross-sectional design of the research that I've described in future rounds of the Joan survey, we're just looking at piloting, we're looking at the acceptability and feasibility of including unique identifiers. And essentially, we won't be, at no point in this process do we sort of use those unique identifiers, but what capturing that information does is enable us to look at trends and changes over time. And it also enables us to predict this with a greater degree of accuracy, the sort of causal mechanisms. So, for example, when we're looking at these school health improvement variables, with the inclusion of unique IDs, we can actually say with a greater degree of certainty the extent to which any changes are associated with that school health improvement activity. Another direction for future research that we believe we need to explore further is about examining the impact of such school health improvement activity on inequalities, as with the present study, but we'd like to do that a little bit more with a little bit more rigor. And then the final sort of direction for future research that I wanted to talk about is about evaluating the impacts of different intervention components. So as I just mentioned, we've largely focused on the quantity of health improvement activity in these studies rather than looking at the quality, and it would be really interesting to look at the quality at some point as well. Okay, and just to summarise, so as you can see from our studies, and I hope you've taken something positive from it, school level data provided through the school environment questionnaire can be used to explore really important issues across health, wellbeing, education and social care. So a lot of my research is actually among vulnerable groups and children in care. I'm really looking forward to using the new School Health Research Network data and the School Environment Questionnaire data to look at issues among vulnerable subgroups of children in more detail. And finally, I just want to say it's really important for schools to complete the School Environment Questionnaire so we can continue to do this type of work and feedback to schools. Thank you.
Thank you.
Sara, and she's sort of done half my job for me, because I was just going to mention the school environment questionnaire, and I know the bulk of you completed that, but if you haven't, then we would still like it to be sent in. And there's some interesting interesting points that Sara's made, particularly and looking at sort of future research, and so I'm sure we'll be following that up in a future webinar. So we're going to move on. Well, first of all, let me say, sorry, which I didn't say at the beginning, if you want to ask a question, there is a question mark box at the top of the screen. And so we have a slightly different screen to look at, so that all you have to do is to press that, and then you can write a question, so you can do that, and we can either follow up at the end, or we can even follow up later through email. So we have one little message there that I've just seen that's flashed up, but I actually can't read it.
It just says higher.
Oh, it just says higher. Oh, thanks. Thanks, Mike. Right, so we're going to move on to our next part of this webinar, which is, you will recognise Gillian, who's sitting next to me. So Gillian hasn't done a webinar up till now, but you'll recognise her from events, and she and I will through emails and chats on the phone. So she's going to talk really from her sort of research perspective about the things to consider when looking at the student health and wellbeing report that will be in your school shortly. And then I'm going to urge you all really to make the most of your report and to share that practice with us. So I'm going to hand over to Gillian.
Thanks, Joan. Oh, and there's Sara's last slide.
sorry, I cut you short.
Well, thank you, Joan, and good afternoon, everybody. I just wanted to start off by saying thank you to all of you who took part in the Student Health and Wellbeing Survey last term. And in case you missed it, Kirsty Williams said thank you very much to you all as well. In the end, we had 193 schools take part in the survey, and of those, 105 were actually taking part for the first time, which was really great to see. And in the end, we had over 110,000 young people taking part in the survey, which is about 3/4 of all secondary school students in Wales. So it really is a huge achievement, and we are eternally grateful to you all for the effort
thank you. I cannot echo that enough. Yeah.
So the student health and wellbeing reports that they're all eagerly awaiting. We have been very busy since Christmas working on cleaning the data to get it ready to populate your reports with. That data cleaning process has taken a little bit longer than we had anticipated. And there are some lessons there for us, I think, with how we organised the survey in 2019 to try and put some things in place that reduce the need for such extensive cleaning after the survey's completed. So we'll be making a note of those things. But currently, we think we're on track to have the reports ready to circulate on the 6th of April. So that's just before the schools in North Wales come back after the half term. And we are doing our very best to meet that deadline. The reports will come to you by email, and they'll be sent to the survey lead that we have registered for your school on our database. And then in the weeks following that, Matt will be working on uploading them onto the network intranet so that they're sort of archived there for you in the future. For those of you who've taken part before, I just thought you might be interested to hear what's going to be in the reports that's different for 2018. And most of these new charts have arisen from the feedback that we had from you at the summer events last year. So there's going to be new charts there on consumption of water. And then there's also one about what students say they think of the support that the school offers for students who feel unhappy, worried or unable to cope. There's a new chart on late night electronic screen use and another one on membership of social network and instant messaging sites as well. And there's also now a table in the report which tells you what students at your school say are the commonest reasons that they think bullying occurs. We've also got a section at the back of the report on other sources of health and wellbeing data in the UK. We've put that in because we thought it might be useful for you if you want to look at sort of the wider context of health and wellbeing in the UK. But also we thought it might be quite a useful resource for some of your students who are undertaking the individual project component of the Welsh Baccalaureate. So all those resources are free to use, and I think there's a secondary data analysis component to the Welsh Bac, so that might be useful for them. So the charts themselves have changed slightly. So as well as presenting data for boys and girls separately in each year group, we also now have a total column where we show the data combined for both genders. So there's slightly more detail there than you've had previously. You may also find that some of your charts look like this and appear to have some data missing, and they may well have some data missing, and I'm going to explain why that is. This will happen where we have fewer than 15 students in that year group who have answered the question that underpins that chart. Now, if there are fewer than 15 boys or girls, but when we add them together, we get 16 or more, then the chart will show the combined gender column like you see on year 8 there. So you do still get some data for that year group. But if there are fewer than 15 overall, then we won't show the school data. You will just see the national averages, as you see for year 11 there. And we do this to avoid presenting percentages of small numbers, which can be a bit misleading and difficult to interpret. Now, you may also find that some charts have no data on them at all for your school. Now, don't panic if you see charts that look like this. This is usually going to be because some charts are based on a subset of students. And in this example, you can see that it's year 11 students who currently use cannabis. And again, we apply that same principle of having to have at least 15 students to be able to report on the data. So if you've got fewer than 15 year 11 students who use cannabis, which is a good thing, then we won't be including your data on charts like this. So for example, this one is age at first cannabis use, again, because it's just not really appropriate to be showing percentages of such small numbers. So always have a look carefully at the title of the chart and any other information around it, just to make sure, and just to check whether you're looking at a chart that's based on a subset of students. So one of the key features of the reports is the inclusion of the national averages, which allow you to see where your school sits in relation to the national picture. But I just want to briefly mention a couple of things to bear in mind when you're looking at that national data alongside what you've got there for your school. And I've got an example here just of some things that we looked at in the 2015 survey. So we've got the number of young people who are meeting the physical activity guideline, Year 11 students who report that they smoke, and Year 11 students who report that they're using cannabis. And we can see there that the national averages for those are 18%, 15% and 9% respectively, which is very interesting. But when we have a look at the school level range for those same health behaviours, we can see that there's actually quite wide variation. So the young people, the proportion of young people who are sufficiently physically active, whilst the national average is 18%, at the school level it varies from 7 up to 30%. And likewise, you can see for smoking, it's an even bigger range from 0 up to 41%. So what does that mean for school health improvement? Well, if you think first about that physical activity example, that's an issue then that's pertinent to all schools in Wales, albeit to a slightly varying degree. So the main message here is don't be seduced by the national average. Even if your school is substantially better than the national average, there can still be substantial sort of room for improvement, and that can still be a topic that you might choose to focus on when you get your report back. Another good example there is the proportion of young people who say they have breakfast every weekday. The national average is nothing for Wales to be particularly proud of, so just because you're above it doesn't mean that that's not something you might want to think about working on. But what those percentages also show is that some issues are really concentrated in some schools. So if we take smoking as the example there, it's still the norm in some schools, with almost half of older students engaging in smoking, whilst in others the issue is almost completely eliminated. But what we really want to emphasise here is that the reason for that concentration in some schools is likely to be because of strong influences in the local context, like the home environment. So, for example, in the case of smoking, the strongest determinant of whether a young person smokes is whether or not their parents smoke. So obviously schools located in areas with high levels of adult smoking, you would then expect to have higher smoking rates as well. So the message here is just to be aware of sort of league table thinking when you're looking at your school's data in relation to the national average. And your school's data may well look a lot worse than the national average, but you might be situated in quite a challenging local context and facing issues that other schools aren't. And what we want to sort of acknowledge here is that you're the experts in your local context. And what we encourage you to do is to use that local knowledge in combination with the data that you're getting in your report to think about what you can realistically change as a school, and also to think about who in your wider school community could help you to achieve that change.
Right, well, thank you, Gillian. And actually that last point I think is really important, isn't it? You don't want to be setting yourself up to be working something that it's going to be hard to make changes. So that's great. So I'm just going to take over and say just to perhaps a little bit more about the sort of making the most of your reports, because I think it's, that's really important. And I just want to sort of reiterate really that we are the only national school health research network in the world. So it's not like we have some blueprint to follow that says, oh, this is what you need to ask the schools to do, to try to do this or to do the other. So we don't have all the answers. And I think that, it's our role to sort of try and look at what happens and look what seems to be making a difference. And so over time, we probably will know a bit more about, this is what you should do. I what I do know from working with you all is that you put a huge amount of time into collecting the data, and it was a big ask of your schools, and that's why Gillian and I are so excited that what you did. So we just want you to make the most of the effort that you put in, both on your behalf and on your students' behalf. So I think that's sort of one point. The other is that, there are people out there to sort of help you and to support you. I'm going to talk a bit about the sort of healthy schools approach, which we're going to encourage you to take once you've got your report. But, share your practice and ask us, and I'll talk a bit about what we can offer your local healthy schools teams. And I've been really aware, since in the last 2 years, just what an interest people in the local authority and in your regional consortium are taking to look at sort of health and wellbeing practice. So we'd obviously urge you to share your results and what you're going to be doing with them to see if they can support you. And what we want to do, as I sort of intimated at the start, is that we want to build this evidence-informed practice for schools so we can start to evaluate promising practice and then share that finding. So the value of the whole school approach is well known, and I think it'd be really good, even at the sort of the earlier stages, to actually look at who you can share, in your school, you can share the findings of your report. So now you can start the list at the bottom and work up, or start at the top and work down. But obviously, I think maybe I'll just start at the bottom, but just to say how important the students are in this. This is student voice. They have filled out the questionnaire, and I remember in the very early days of starting our network, I talked to a head teacher who thought that actually perhaps really it could almost all go to the student voice, and that they could look at what the issues are and sort of put actions into place, or certainly to decide what the priorities are. So it's very important, and it could be student voice groups, and of which there are many in the schools. So you've got obviously the school councils, but there's also the specific groups like the sports ambassadors, so they would be interested in some of the data. I think a lot of the schools have school nutrition action groups, or sort of food and fitness groups, so they could be looking at that. Your eco group, because they look at sort of well-being as well, would all be interested. But whatever it is, that you really want a whole school approach to that, so sort of everybody feeding into those student voices. Then in terms of sort of the staff, it's really sort of, again, it's all really, because they'll all have a different interest. So the senior leadership team and the governing body looking at overall, the health and wellbeing needs of the school. If you've got a sort of health and wellbeing team of staff, both teaching and non-teaching, obviously that's going to really sort of focus your actions in the future. The subject teachers, a lot of subjects do have a sort of health and wellbeing element, and obviously it'd be really good that they look at what's appropriate to be teaching at that age, and also the data could be useful for them too. Pastoral care team. So I know if you've seen the report or an example report, you know that we feedback by the different year groups, and it's sometimes very clear as to what support may be needed in which year group. And then, don't forget the sort of non-teaching staff. So there's a school nurse who would obviously be interested. Got any sort of counsellors and other people involved in sort of wellbeing initiatives too. Perhaps the thing that makes people think, oh, this is gold dust, this is why we have perhaps the number of schools, 212 schools on our network, is that sort of self-assessment of health and wellbeing needs. So it's obviously invaluable for use for that. And once you've done that, then we've got some actions that schools have shared with us over the past, and these are all going to be on our website in one place so that you can easily access them when you come back from Easter and you've got your own data. So we had Al in school, and I think Emma is with us, but showing how they did separate action plans with their different student voice and staff groups, and those all got fed into the school development plan. And then we had other schools where it was sort of a PLC approach, so the representatives of staff and students were all in a group looking at the data and then sort of feeding back on joint actions. And then there could be all sorts of different ways that might work in your school, and we'd really like to hear about them, so do let us know. This is I've taken this from the report because that was just a sort of suggested way of working. I'm sorry, I don't know whether you'll be able to see clearly the wording on that, but I think where the sort of arrow comes in, we're sort of thinking that, you know, once you've got your data, that's where you'll enter, you know, just at the start where we're saying share data across the school community, and we've talked about who that might be. And I think then it's the sort of, considering what the sort of action planning, not only for areas of interest. Gillian's talked about some of the areas of concern might not just be because you're sort of, lower or higher than the national average, although that's a sort of useful benchmark for a lot of them. But also just celebrating, you know, I'm all for a bit of positive sort of celebrations about maybe some of the health behaviours, particularly if you have worked on them in the past, and that's what you'd like to do. As I say, remember that there are people out there who can help you, and so ask for that support. I think the important thing is this sort of getting a manageable action plan that can feed into your school development plan, so everybody, you know, it will happen and you will work at that. And also we had Estin presenting at our summer events, so just to sort of remind you that they were sort of saying, obviously, that self-evaluation for going into inspections is so important. So make sure you really share what you're doing with the data and how you're using it and how you're actioning it and what the results might be. They were saying that they'd be quite interested to talk to students in the school to see what impact that was having on them. So that's an important, obviously an important part to use. And again, it'd be interesting to hear if any of you'd like to share that in the summer events as to what you've done there. And then remember that if you're putting action in place, you do want to sort of do some sort of evaluation of what difference they might be making, and obviously that could be a local evaluation in your school, but it also, remember, in 2 years' time you'll have data again, so that gives you another way of sort of using the sort of numerical data to evaluate what difference there has been. And then we want you to sort of, you know, obviously reflect on those findings. If you've done sort of internal, this little chart of this circle can go as many times around as you want. It doesn't have to just be on the 2-yearly cycle. But I think probably the stage that you know, I'm thinking as a teacher, gosh, would I have remembered, but that once you've put different things in actions, then your policies need to reflect what you've done, and so all the paperwork is all linked, and then, you know, you can sort of continue around there the approach again. Just to remind you, I know we've said at the summer event, and this was a slide I used then, there's clear evidence for the need of a whole school, healthy schools approach to developing actions. So not just sort of one-off assemblies or one-off something else. You actually look at it within that framework. So if you're doing looking at sort of leadership communication, what are your policies in this area? Are there some training needs? Engaging with national and local initiatives, the curriculum. So it is the whole curriculum, but it's also out of school hours learning as well, sort of after school clubs or trips or whatever. So it's broader than just that. The ethos of involvement of all, participation of all in the school, looking at the environment and other aspects of ethos, and then that link with the family and community and external agencies. And so we've, sort of part of the self-evaluation and action planning, but then there's a sort of, you've got this data in school, and schools have told us that that's just really valuable because it's an easy to read approach to sort of numerical data. So obviously there's the planning of curriculum, which will be part of an action plan, but there's also using that data in all sorts of different subject areas, and it's an ideal opportunity for then health to be raised within different areas of the curriculum that they might not always be included. So PSE, science, PE, maths, IT, drama, health and social care, food technology. There's a huge range that could be used. I mean, the numeracy work, as I say, easy to read charts, that would be helpful there, schools have told us. Gillian mentioned the sort of Welsh Baccalaureate individual project. A lot of young people choose a sort of health topic, so remind them that that data is in their school. And then sort of linking across outside the school to families and community. And remember all of the supportive local agencies and people who are in the school anyway. And you don't have to solve every issue on your own, so use the expertise. We can help in, there's 212 schools and us, so, but we are always on the end of a phone or an email, so do let us know. As I say, the website, there'll be this section with everything that you've ever told us about using the data. The research briefs and webinars are all stored there, and that's where this evidence is about what seems to support student health. We've heard today about the last one was on sex and relationships education with quite clear pointers as to what would be useful. So they're there. The summer events will support you, and then obviously we try to work with regional and national partners so that it means that they're more receptive to be supporting you. And that's just the end of what I wanted to say about the reports. As I say, do contact us if if there's anything that you want to have clarified. I just want to very quickly, we've sent a newsletter out, but just a very quick reminder of the things that are in there. So one is that we're just to introducing you that Cheryl left, and we now have Matt Davis, who you'll meet in the summer, and he comes from the MEP programme, so some of you actually may know him. He's settled in incredibly well, and what is nice is that he's happy to chat in Welsh over the phone or by email. His photo's in the newsletter if you want to see what he looks like. School environment questionnaire is thanking those that have done it. We really know that you have lots of priorities and other things that you have to do, but so we really appreciate your time, but it's really valuable for us, and you know how valuable it is in terms of what it does with the national data. So do send it or email me if you've got any questions about that. Summer events in the newsletter, you can actually sign up for them now. They're in June, and it's just such a valuable opportunity. We love to meet you all, and I know that it's a really good time for you to network with each other as well. So the 12th of June in Llanelli, the 14th of June in Cardiff, and the 20th of June in Deganwy. And that's just to say just the sorts of things. Well, obviously we'll have feedback we'll be asking your feedback on how the survey and the school environment questionnaire went, so that we can make improvements based on those comments for 2019. Share how schools using, or what I've been saying, share and give us suggestions as to what you've done with your reports. And also this will be done informally in groups, but we will want presenters, so please don't be shy and get in touch. Even if it's a small thing, we can have lots of little presentation. We don't have to have really one or two very big ones. So we'd love to hear from you. We will be sharing some of the research that's been going on, and just to say we're delighted this year we'll have an update on the development of the health and wellbeing area of learning and experience of the new curriculum. So it'll be sort of near completion, and we've got the representatives of the pioneer group who will present on that, and there'll be opportunity for discussion and feedback. So that's pretty much it, except to say we're going to try something a little bit different. We're going to do a sort of web discussion. It won't be a formal webinar, but if you're interested, the details of that are in the newsletter. So let us know about that. And then just a quick message from the Children's Commissioner. They're looking for 15 young people from across Wales to join their Young People's Advisory Panel. They'd like some experience, but obviously if they've been working with you on this, then that would be ideal. And they're keen for inquiries from everyone, but so do get in touch if you think that'd be useful. I'm sorry, we just nipped over the time, but I hope that was useful, and obviously it'll be on the website soon for you to catch up. So can I thank everybody who's been presenting and say thank you for joining us.